I joined the U.S. Peace Corps before medical school, and it was during the U.S. Peace Corps service that I really became passionate about pursuing medicine as a career. I was stationed in Benin, West Africa as a volunteer in a small village on a disease eradication mission, and there I learned about diseases that affect marginalized populations and persons living in areas with limited resources like malaria, and developed a passion to combat these diseases. We've partnered with a group in Uganda at the Infectious Diseases Institute, and we're looking to study the pharmacokinetics of a drug that's used to treat severe malaria in children called artesunate. It's a life-saving drug, but we don't know a lot about it in terms of its effects on the body systems in general. So we know that it clears parasites, that it kills parasites quickly, but the dosing might be able to be refined such that we can get even better outcomes with this drug in treating severe malaria in kids. It represents progression of malaria that first starts in the blood and then begins to affect other organ systems in the body, including the brain. It's very difficult to successfully treat that after the disease has progressed to a certain level. So improving therapeutics for children and others with cerebral malaria is important because they are at a very critical stage of life and death. And if there is anything that we can do to improve the therapies at this very late stage, it could mean life or death for that individual. The World Health Organization set the goal of 90% reduction in malaria by 2020 compared to 2015 estimates. So we're very far from that target and we have a long way to go. So conducting research in those areas where malaria is endemic is essential to understand the disease, to know if the treatments and therapies that we are using are effective, and also to partner with communities that are most affected by these diseases and are very passionate about combating them. Malaria is mostly experienced by US citizens when they travel abroad and they take medication to prevent it. But recently, and since malaria has been eradicated, we have seen cases of malaria in Maryland and other states, and these cases occur in people who have not traveled outside the US. So the potential for malaria to return to the US is still here. The advantage of studying and working on malaria abroad is that if we make advances abroad and help to reduce and eliminate malaria abroad, then we can reduce the risk not only to communities where malaria still exists, but we can also reduce the risk to US citizens who live at home and who might be at risk if malaria were to be reintroduced. Being a pediatrician, I'm obviously very passionate about children and the health of children and ensuring that children have a safe and healthy environment where they can thrive. And I think that is a common goal that all of us have, is to ensure that children, not only in our communities, but also in other communities, benefit from that very safe environment that we provide for them. By reducing diseases and other threats that could kill them, we are ensuring that they not only have a safe environment, but they can also thrive academically, they can attend school without being sick, they can go on to pursue careers and education that allows them to advance and live healthy and long lives.